Welcome to our video exploring 6 warning signs of pancreatic cancer. This form of cancer poses a significant challenge to the field of oncology, ranking as the third leading cause of cancer death in the United States. The pancreas, a critical organ located deep in the abdomen, is essential for digestion and blood sugar regulation. Unfortunately, its hidden location makes early detection of pancreatic cancer particularly difficult. Many patients remain asymptomatic until the disease has progressed significantly, contributing to its grim outlook. However, there is hope. By learning to identify the subtle early signs, we can increase the likelihood of an early diagnosis. In this video, we will explore these signs, explaining their importance and implications for your health. We will discuss symptoms such as jaundice and digestive changes and connect them to the functions of the pancreas. We will also examine risk factors that can increase your chances of developing this disease. Ready to gain valuable health insights? Don't forget to like, subscribe, and join us as we dive in. Please note that the information provided is based on medical research and recommendations from leading cancer organizations. Let's start with one of the most recognizable early symptoms. 1. Jaundice. Jaundice, a condition characterized by yellowing of the skin and whites of the eyes, is one of the earliest and most obvious indicators of pancreatic cancer. This occurs due to a buildup of bilirubin, a yellow-brown substance produced when the liver breaks down old red blood cells. In a healthy system, bilirubin travels through the bile duct to be excreted. However, pancreatic cancer can block this pathway, leading to bilirubin building up in the bloodstream and the characteristic yellow color. It's important to remember that jaundice can result from a variety of conditions, such as hepatitis or gallstones. When associated with pancreatic cancer, it is often accompanied by additional symptoms, which we'll discuss later. While jaundice isn't always indicative of cancer, it's a crucial warning sign that something may be wrong with your digestive system. An early diagnosis can pave the way for timely treatment, potentially improving outcomes. Don't ignore this visible change in your body. It could be your pancreas telling you that something is wrong. 2. Persistent nausea and vomiting. These symptoms may indicate pancreatic cancer, especially when they occur without an obvious cause. They are often the result of the tumor's effect on the digestive system. As pancreatic tumors grow, they can put pressure on the stomach or small intestine, interrupting normal digestion. This pressure can partially block the digestive tract, causing feelings of fullness, nausea, and vomiting. It's important to distinguish between occasional nausea and ongoing symptoms. While stomach pain is common from time to time, nausea and vomiting related to pancreatic cancer are typically persistent and can get worse over time. These symptoms are often more pronounced after meals, especially high-fat or heavy meals. You may also notice a loss of appetite or feeling full quickly, which can contribute to unintended weight loss. Paying close attention to the patterns of your digestive discomfort is crucial. If nausea and vomiting become regular problems, especially when combined with other unusual symptoms, it's time to see a doctor. 3. Persistent itching. Persistent, unexplained itching, medically referred to as pruritus. This symptom is often overlooked or attributed to other causes, but it is important to understand its potential significance. Itching associated with pancreatic cancer is usually widespread, occurring throughout the body rather than confined to a specific area. It is often described as severe and unrelenting, unresponsive to common treatments such as moisturizers or over-the-counter anti-itch creams. This symptom is thought to be caused by the buildup of bile salts in the skin. When pancreatic cancer blocks the bile duct, the flow of bile is interrupted, causing these salts to build up in the bloodstream and eventually deposit in the skin. Itching may precede more obvious signs of jaundice and is often seen on the palms of the hands and soles of the feet, although it can affect the entire body. If you experience persistent, unexplained itching that does not improve with standard treatments, it is worth paying attention. Although this symptom can be attributed to a variety of causes, such as dry skin or allergies, it is important to report it to your doctor, especially if other unusual symptoms are present. 4. Abdominal pain. Abdominal pain, especially in the upper abdomen, can serve as an early indicator of pancreatic cancer. This discomfort often has distinct characteristics that differentiate it from normal stomach pain. Patients commonly describe the pain as a dull, aching sensation that may radiate to the back. It tends to be worse when lying down and may improve when leaning forward. This is because the tumor can press on nearby organs and nerves, causing discomfort. As the tumor grows, the pain often becomes more severe and persistent. Some people experience a gnawing sensation that is worse after eating, especially after consuming fatty foods. This happens because the pancreas releases digestive enzymes in response to meals, and a tumor can interfere with this process, exacerbating the pain. It is important to recognize that abdominal pain is a common symptom associated with many conditions. Persistent or severe abdominal pain, especially if accompanied by other unusual symptoms, should not be ignored. Although it can be caused by a variety of conditions, such as indigestion or pancreatitis, it is essential to seek medical attention when the pain is constant and unexplained. 5. Sudden onset of diabetes. Diabetes that develops unexpectedly, especially in individuals with no history of the condition, can be an early indicator of pancreatic cancer. This connection stems from the pancreas' dual role in the body, producing both digestive enzymes and hormones, such as insulin, which regulate blood sugar. When pancreatic cancer disrupts the organ's function, its ability to produce insulin effectively may be impaired. This disruption can cause a sudden onset of diabetes symptoms, such as increased thirst, frequent urination, blurred vision, and unexplained weight loss. It is important to distinguish this from the gradual onset of type 2 diabetes, which is often linked to lifestyle factors. Diabetes associated with pancreatic cancer usually develops rapidly and without clear risk factors. If you have been diagnosed with diabetes that seems to appear suddenly, it is worth discussing further testing with your doctor. While new-onset diabetes is most commonly linked to other causes, its connection to pancreatic cancer should not be overlooked. 6. Changes in the color and consistency of stool and urine. When pancreatic cancer blocks the bile duct, it can cause noticeable changes in the color of your urine and stool, which can serve as important warning signs. Your urine may darken, appearing brown or amber, due to high levels of bilirubin in your bloodstream. On the other hand, your stool may become lighter or clay-colored because the bile that normally gives stool its brown color is blocked from reaching your intestines. Additionally, pancreatic cancer can interfere with the proper digestion of fats, resulting in stool that looks greasy, floats, or has an unusually foul odor, a condition known as steatorrhea, which is caused by undigested fats passing through your digestive system. While changes in the color of your stool and urine can be caused by a variety of factors, such as diet or medications, persistent changes should not be ignored and warrant a medical evaluation. Risk factors. Recognizing the risk factors for pancreatic cancer can help identify individuals who may benefit from closer monitoring. Although anyone can develop the disease, certain factors significantly increase the likelihood. Genetics. Family history plays a significant role. Those with a family history of pancreatic cancer or certain genetic syndromes are at increased risk. Mutations in genes such as BRCA1 and BRCA2 are particularly associated with an increased likelihood of developing pancreatic cancer. Age. Age is a critical factor, as the risk of pancreatic cancer increases with age. Most cases are diagnosed in individuals over the age of 65, which underscores the need for vigilance as people age. Smoking. Smoking remains one of the most significant modifiable risk factors. Smokers have a significantly higher risk of developing pancreatic cancer than non-smokers. However, the risk decreases after quitting, highlighting the importance of quitting smoking for long-term health. Chronic conditions such as diabetes and chronic pancreatitis are also linked to an increased risk of pancreatic cancer. In particular, long-standing type 2 diabetes has been shown to be significantly linked to this disease. Additionally, obesity and a sedentary lifestyle contribute to an increased risk. Maintaining a healthy weight through a balanced diet and regular physical activity can help reduce this risk. Exposure to specific chemicals, particularly in industries such as metalworking, has also been linked to pancreatic cancer. Implementing and adhering to workplace safety protocols are essential to minimize these risks. It is important to remember that experiencing one or more of these symptoms does not necessarily indicate pancreatic cancer. Many of these signs may be the result of less serious conditions. Thank you for watching this video. If this information was helpful to you, please give it a thumbs up and share it with others who might benefit from it. Don't forget to subscribe to our channel to receive further health content. Remember, taking proactive measures for your health is an investment in your future. See you in the next video.